Hi, this is Selena here, and today on this video, I'm going to be talking about how to choose and use your medical insurance, and that is your health insurance. You could be getting your insurance through your job, or you could be getting your insurance on the exchanges, which for many states is the federal healthcare.gov, which is the marketplace, also known as Affordable Care, also known as Obamacare. If you got insurance from a major plan, there are four main terms that you want to understand when you're trying to choose your plan, and also when you're actually using insurance, you want to know how to use it so you know exactly what you're going to be paying when you go to the doctor. The first term is called a copay. The second one is called a deductible. And then there is something called co-insurance. And then the last thing I want you to know is the maximum out of pocket. We call it a MOOP, M-O-O-P. All right, so these are the four words we're going to talk about. The copay is going to be a fixed dollar amount. It could be $10, $20, $30, $40. A copay is a set amount. And normally that's what you pay the day you walk in the door to receive your services. So let's say you have a primary care doctor, copay of $10. And then you have a specialist copay of $20. This is just an example, okay? So what happens is when you go see a regular doctor, your primary care doctor, which is usually an internal medicine doctor or a family medicine doctor, you're going to pay whatever that copay is the day you walk in the door to see the doctor. Expect to pay that. If you go see a specialist, such as a cardiologist, endocrinologist, OBGYN, pulmonologist, podiatrist, these are all specialists, then you're going to pay the specialist copay. So you pay $20, and that usually covers your office visit and your consultation with your doctor. Some other services, some plans may have copays associated with other levels of service, but it's a flat dollar amount. The next term you want to understand is a deductible. A deductible is what you're going to pay for the actual service that you receive, and it's what you pay initially before the actual insurance starts to kick in. So you may find you have a $0 deductible, which would be great, or you may have a $500 deductible, or you may have a $1,000 deductible. So a deductible, let's say, for example, you need to get an ultrasound, you need to get an MRI, you need to get an X-ray, you need to do surgery, you go into the emergency room, or you're admitted into the hospital. Any of those services that you receive, the deductible is what you have to pay up to first. So for example, let's say you do an MRI, and the MRI is $500, and you have a $500 copay. Then a deductible here. Then that means that you're going to pay the first $500 worth of medical bills. So you pay the first $500 worth of medical bills, and then the insurance kicks in after that. So the lower the deductible, usually the more desirable the plan is going to be when it comes to how it's going to pay for your medical bills. But also the lower the deductible, sometimes the payment will go up as well for your monthly payment to purchase that plan. The higher the deductible, and I have seen even some plans have $6,000 deductible or $8,000 deductible, that would mean that you're going to have to pay all your medical bills until you finish the high deductible. Those are called high deductibles, right? And then after you finish the deductible, is the plan going to cover 100%? Well, not necessarily, because you have something called a co-insurance. A co-insurance is going to be a percentage of your medical bills that you're responsible for after you finish your deductible. So for example, you may have an 80-20 plan, which means you have to pay 20%. You may have a 70-30 plan, which means you have to pay 30%. Or you may have a 60-40 plan, which means you have to pay 40%. So if you have an 80-20 plan, it means the insurance company is going to pay 80% of your medical bills, and then you're going to pay 20% of your medical bills. And then if you have a 70-30, the insurance company pays 70% of your medical charges, and then you pay 30%. And how it usually works is when you get some sort of service, let's say you do a CT scan or surgery what happens is they're going to, the provider's going to check and see if you met your deductible. You pay up to your deductible first, and then anything after that, they bill the insurance company. The insurance company is going to pay their 80% in this example, and then you pay the rest, and that bill usually comes in the mail another month or 2 months later. So this is called a co-insurance. And then a maximum out of pocket is a dollar amount that is the most you're going to pay all year for everything that you do. If you reach your maximum out of pocket, everything is 100% covered by the insurance company. So for example, let's say you have a $5,000 maximum out of pocket. Let's say you have a $500 deductible, a 20% co-insurance, and a $5,000 maximum out of pocket. You pay the first $500 worth of medical bills, and then you pay 20% of everything thereafter. But if all the money that you pay out of your pocket, including the copays that you've paid, including the deductible, including your 20%, if it starts to add up and it reaches whatever that maximum out of pocket is, then the insurance company covers 100% of the rest of your medical bills from that day until the end of the policy, which is usually December 31st. And then January 1st, it'll start over again. So this maximum out of pocket could be $5,000. It could be $8,000. It could be $9,000. Okay, so it could be any of these. And once you hit your maximum out of pocket, you're 100% covered. So let's give an example. Let's say you go see your primary care doctor and you have a back pain. And then your primary care doctor charges you $10 to go in there to talk to them. They say, you know what, you need to see an orthopedic. So then you go book your appointment with the specialist, and then you go to see the specialist. They charge you whatever that specialist copay is. It could be $20, $30, $40. In this example, let's say it's $20. So you pay $20 to see the specialist. The orthopedic doctor tells you, hey, you know what, we need to do an MRI on your back or x-ray on your back. And let's say your plan has a $500 deductible. Then let's say the procedure is $1,000. You go check it out, and then you pay the $500. And then let's say your co-insurance is 30%. So you're going to pay, let's say if your procedure is $1,000 in this example, then you're going to pay the first $500. Then that's going to leave you $500. And then from this, you have to pay 30% because that's what's left over after you've met your deductible. So then you pay 30% of that, and that is going to be your co-insurance. And then let's say the doctor says you need to do surgery, and then the surgery is like $20,000. Then you're going to pay 30% of the surgery, but no more than whatever your maximum out of pocket is total. So let's say your maximum out of pocket is $5,000, for example. So the $10 you pay, the $20 you paid, the $500 you paid, and all the 30% thereafter, if all of that adds up to $5,000 in this example, then that's all you pay for the rest of the year. And it doesn't matter what else you do the rest of the year, everything is 100% covered, as long as it's in network and as long as it is medically necessary. So this is how this works. So now that you know these terms, what you want to do when you're looking for an insurance is usually going to be good to get a lower deductible. And also you want to see copays for those office visits. If you choose a plan that doesn't show copays and it has a high deductible, what that's going to mean is that you're going to completely pay everything out of pocket until you reach the deductible, and then you're going to pay whatever the rest of the things are for the co-insurance and out-of-pocket maximum. Some people do choose high deductible plans, and those are usually people who want to find the cheapest plan, like the least monthly payment plan, least premium. There's HSA accounts where basically you have a high deductible plan. It has to have the words HSA behind it. And then you can take whatever difference you would have saved and you save it in your HSA account, and you get a tax deduction for it. And then the money in your HSA account that you saved will actually go towards paying some of the medical costs with that high deductible plan. Some people do that, but for a majority of the people out there, especially if you have health issues and you have to go to the doctor regularly, or any kind of like ongoing high blood pressure, cholesterol, diabetes, you're not going to want to choose a plan like that for the most part. You want to definitely have a copay associated with your doctor visits, as low a deductible as possible that you can afford, and then choosing the co-insurance, a lower one is good. Now, if you have a major surgery coming up and you know you have this thing coming up, you have a lot of medical bills, you have cancer, you have something major going on, you know that you're going to reach a lot of medical charges, in that case, you might want to find a plan that has the lowest out-of-pocket maximum. You may even find a plan that has $2,500 maximum out-of-pocket, or $1,000 maximum out-of-pocket, or $3,000. If you know you got major things going on, then that may be the way you're going to choose your plan. And then one last thing I want to talk about when choosing your plan is understanding that all insurance plans have what's called a network. That means that the insurance company gets a contract with every doctor, clinic, facility, hospital, pharmacy, and they have a contract where they have already agreed upon the prices that they're going to pay for the services for the doctors in the clinics that they provide. So you want to go to only the facilities and the providers that have a contract with your insurance plan. And this is called staying within your network. There's no such insurance you're going to purchase that you're going to go to any doctor you want. It doesn't work like that. You have to go to the doctors that have a contract with your insurance plan. And this is called a network. If you have an HMO plan and you go out of your network, your insurance company won't pay any of the medical bills at all. But even if you have a PPO plan, they may allow you to go out of your network. That is one reason people like PPO plans, but it's not necessary. As long as you stay in your network, it doesn't matter which one you choose. But if you choose a PPO plan and they say you can go out of your network, well, just understand that all of these numbers will be different if you choose a PPO plan and go out of network. Yes, they may allow you to go out of network, but all of these numbers normally work for their in-network plan, in-network providers, their in-network doctors. So make sure even if you have a PPO plan, you still choose your network. You still choose doctors and facilities and clinics in your network so that you can pay the right predictable prices that you want to, that is associated with your plan. All right. So I hope this helps you to choose and also use your health insurance wisely. And if you have any questions or any comments, please put them in the comment section. I love to read those and I love to respond to those. And then at the same time, please like and subscribe our channel and help us grow. And we're going to be putting out more great information for you so that you can be financially literate and understand how your money is going to work and work for you. Thank you so much for tuning in.